All right, everyone. It's now 3 minutes after the hour, and we're going to go ahead and get started. Hello. Thank you for joining. It's such a pleasure to welcome you. My name is Rebecca Neal, and I will be your moderator this evening. I am so pleased that you've chosen to join us, and I'd like to thank Dr. Fein of Princeton Longevity Center and Dr. DiBernardo of New Jersey Plastic Surgery for coming together on this important men's health webinar. We will be doing a Q&A portion of our presentation today. So please feel free anytime during the presentation to ask your questions using that little Q&A box down towards the bottom of your screen. And we will take questions at the end of the webinar. For those questions that we do not have time to get to this evening, do not fret. We will be answering all questions via a blog post on our website that you will all have access to after the webinar has concluded. So be on the lookout for that via email. I do have a little bit of a giveaway announcement as well. So for all of you that are here with us live today, I'm very excited to share that we will be doing a drawing at the end of the presentation for those that stick around throughout the next hour or so for an M-Sculpt Neo treatment, which is $4,000 in value. We'll be private messaging somebody on random from the drawing as a winner at the end of the webinar. And Dr. DiBernardo will have more information on that during his presentation. So we're going to go ahead, dive right on in, and I'd love to introduce our speakers this evening. So starting with Dr. Fein. He is the founder and medical director of the highly acclaimed Princeton Longevity Center, the leading health, vitality, and longevity center in the United States. A pioneering leader in his field, David boasts over 30 years experience helping thousands of patients prevent disease and live better, longer, and healthier lives. We also have Dr. Barry DiBernardo joining us this evening. Dr. DiBernardo is the medical director of New Jersey Plastic Surgery, located in beautiful Montclair, New Jersey. With over 30 years of experience, Dr. DiBernardo is a leading voice. I will now go ahead and hand this presentation over to Dr. Fein, who will speak on men's health and vitality.
Well, thank you very much, Rebecca, and good evening to all our participants who are here with us tonight. Let me just tell you a little bit about what we've been doing here at Princeton Longevity Center for the last 20 years or so. Our mission has been to push the frontiers of early disease detection and prevention to help our patients stay healthy for their future years. We spend a lot of time with our patients talking about how we can prevent cancer and heart disease and diabetes and other chronic illnesses, but we also focus on what we need to do to keep an optimal quality of life for our patients, including the changes that are really inevitable with the passage of time. And that includes how things are going with our sex lives as well. While many of us are shy about discussing or even acknowledging change in sexual function and performance, sexuality is really a vital part of our lives. It's important to our relationships with others. It's important to how we feel about ourselves. So let's start off with a discussion about some of the factors that can impact both sex drive and performance. We'll talk also a bit about what is needed to have good function, the things that can interfere with achieving and maintaining good erections for men, and one of the latest treatment techniques for how you can improve that. And so whether you're having substantial issues or you just wouldn't mind if you could maybe get things to work a little more like they did 20 years ago, there are some very interesting and very helpful non-invasive and painless ways that we can help you to turn back the clock on how things are working for you. Now, sexual performance in both men and women is a pretty complex process and involves both psychological and multiple physical processes that all really have to work just right to produce the desired outcome. Now, from a physical standpoint, let's talk first off about what do you really need to do in order to get good performance. So show you some of the things we can do here. Let's talk first off about really what's necessary to have a good normal erection. I mean, erectile function basically is just plumbing and hydraulics. And so one of the most important things you need is the ability to increase blood flow on demand into the specialized tissues within the penis. In order to do that, that's going to require, first off, some clean pipes, some good plumbing. Basically, starting as early as the late teens, the process of atherosclerosis or plaque formation begins in the arteries. Over the years, the arteries gradually can become narrowed and eventually reduce blood flow into the penis. In men, plaque typically becomes detectable first in the coronary arteries and then tends to spread peripherally from there. But what we typically think of as risk factors like cholesterol are actually terrible at predicting who is actually starting to make plaque and who is developing the process. The best way to really determine whether or not you're actually making plaque is to actually look directly at your arteries. As part of our evaluation, we start with a coronary artery calcium scan. There's a clear association between developing coronary artery disease and impaired blood flow in the pelvis. What you're seeing here is actually examples of scans from some of our patients, and the white spots that you're seeing in these scans indicate the presence of calcium deposits. And those calcium deposits mean there's plaque present in those arteries. If we find that, we can generally reverse it or at least stop it or slow it from progressing before it becomes a problem for interfering with blood flow elsewhere. We can also do full body scans as part of our evaluation to look for evidence of vascular disease directly down in the pelvis and elsewhere. And one thing to keep in mind when it comes to the vascular aspects of this, plaque may show up first in the lower aorta and in the more peripheral vessels, typically in smokers. That process probably is related more to nicotine than it is to the combustion products of the smoke itself. So even if you're switching over to doing vaping or using other nicotine products, whether it's the nicotine gums or nicotine patches, my first suggestion is stop. Nicotine tends to constrict arteries. It reduces blood flow. Nicotine is not a good way to improve erections. So keeping your arteries clear and proactively detecting the earliest signs of plaque formation so that you can get on an individualized treatment regimen to stop further plaque is really key to maintaining good function. And we're going to talk in a little bit too about some of the new technologies for even improving or restoring blood flow where you need to get it if you already do have plaque that has started to develop. Now, the next ingredient that you're going to need is normal nerve function, because the nerves basically are acting like the valves in the plumbing to turn the flow on and off. So anything that impairs nerve function can potentially impair erectile function as well. That includes conditions like diabetes, which in the US is the #1 cause of nerve damage. In our exams, we can see diabetes coming 5 or 10 or more years in advance and show you how to prevent it. And if you already have it, then getting really good tight control of your blood sugar really becomes key for preventing any kind of nerve damage from developing. Another thing to bear in mind, the second most common cause of nerve damage in the country is actually alcohol. Alcohol is highly toxic to nerve function. And even in the short run, even before it actually has damaged nerves, keep in mind what Shakespeare said, alcohol provokes the desire, but it takes away the performance. So keeping alcohol use at a reasonable to minimal level is also really very, very helpful. And then the third ingredient that we're going to need is optimal metabolic function. And that means maintaining an adequate testosterone level. And it also means having good ability to produce the cellular components that are important for signaling the vascular function. So starting around age 30 or so, testosterone levels in men typically start to decline, usually at a rate of about 1% per year. And as your testosterone level goes down, you'll see all sorts of symptoms that go even beyond affecting sexual performance. You'll start to see decreases in energy level. You'll see weight gain. You'll see loss of muscle mass. It affects, low testosterone levels will cause changes in cognitive function and affect moods and cause depression. And on top of that, we typically also see low bone density. We actually find low bone densities present in about 40% of the men who come through our exams. In a lot of men, testosterone levels will fall even faster than that 1% per year rate. And the most common reason we see for that is something that we refer to as visceral fat. Now, visceral fat is fat that occurs inside the abdomen as opposed to just subcutaneous fat that occurs under the skin. So here we have two examples of scans of the abdomen done on our CT scanner from patients who from the outside really look identical. But the patient on the left here, that arrow there is pointing to, that's the skin that we're seeing there. That light gray band that goes around the abdomen, that's the abdominal muscles. And all of the dark gray material that you're seeing in between the skin and the muscle, that's subcutaneous fat. Subcutaneous fat is actually relatively benign. It may not be cosmetically your most favorite thing, but it's not associated with nearly as many health problems as visceral fat. Now, if we look at the other patient, what you'll see is a large area of that same dark gray material, that same fat, present inside the abdomen, wrapped around the internal viscera. And that's why we refer to it as visceral fat. Now, the problem is, unlike the subcutaneous fat, visceral fat is very metabolically active. And aside from having effects like increasing your risk of diabetes and high blood pressure and even risk of certain cancers, visceral fat contains an enzyme called aromatase. And aromatase is very efficient at converting testosterone into estrogen. So if you have a high level of visceral fat, it's almost certain you're going to have a low testosterone level. And even if we try supplementing your testosterone or you try taking products to raise your testosterone level, if you have a high level of visceral fat, you just end up converting that testosterone into estrogen. So you really need to get rid of the visceral fat. And the way to do that is by limiting your carb intake. High carb diets will tend to promote visceral fat, and also by increasing your exercise, because exercise improves the way that your body processes carbs. There are a few other things you can do to help to support your testosterone level too. In addition to a low carb diet and exercise, keeping your sleep adequate is very helpful. Minimizing stress levels, also helpful. There are pharmacologic options that we can employ too. There are a group of medications called aromatase inhibitors, and they actually help to block that enzyme in the visceral fat so that we can block the conversion of testosterone into estrogen. And in those people then who have a problem with too much visceral fat, that may help to raise their testosterone levels for them. We can also supplement testosterone directly. It can be given in a couple of different forms. We can give you a transdermal testosterone preparation, which is basically a gel that's applied to the skin once a day and gets absorbed directly through the skin. That can help to raise testosterone levels somewhat. Testosterone can also be given by injection. A typically once a month injection will help to raise your testosterone level. Unfortunately, you can't really give testosterone orally. It doesn't actually manage to make it past your liver when you take it orally. So you can try taking oral testosterone, but it's not actually going to have a substantial effect on your testosterone blood level. Now, once we've normalized your testosterone levels, the next step is we need to make sure that you're getting adequate vascular signaling. By that, we mean making sure that the chemicals that are produced within the blood vessel wall that tell the arteries how to dilate, when to increase the blood flow where you need it, we need to make sure that you're able to make those adequately. The most important of those compounds is something called cyclic GMP. When you make more cyclic GMP in the lining of the blood vessel wall, the artery dilates, increases blood flow. That's where medications like Viagra, Cialis, the generic name for Viagra is sildenafil. You see it here in this picture. Sildenafil works by blocking an enzyme called PDE5. And PDE5 breaks down cyclic GMP. So by blocking that enzyme, we raise your level of cyclic GMP in the artery wall, and you're able to better dilate the artery and increase the blood flow. Now that's great, and those medications can really be super helpful and can work very, very well. But the problem is that in a lot of people, as we get older, our ability to make cyclic GMP in the first place starts to decline. And that is because cyclic GMP is made by another enzyme which is switched on and off by production of a substance in the artery wall called nitric oxide. Nitric oxide is very important throughout the body for regulating all sorts of processes and regulating blood flow to organs throughout the body. So as we start getting older, or if we have atherosclerosis, if we have diabetes, if we have other medical conditions, our ability to make nitric oxide can be impaired. And that can even lead to problems such as you take Viagra or you take Cialis and find that it just doesn't really give you quite the response that you really want, because the problem isn't that you're breaking down cyclic GMP, it's that you're not making it in the first place because of a deficiency of nitric oxide. Now, nitric oxide is actually produced from an amino acid in the body called arginine. Now, you can take supplemental arginine. It's fairly readily available. You'll find it at CVS and Walgreens, and it will actually help you to make more nitric oxide. But the problem with arginine is it doesn't stay in the bloodstream very long. It typically will peak in about 30 minutes and then start to decrease because it's rapidly taken up by the liver and converted into other substances. It's used for protein synthesis in the liver. And so you can get a benefit out of arginine, but not for a very long period of time. It makes it not really all that practical. Instead, what we generally recommend is a different amino acid supplement called L-citrulline. Now, these are just amino acids. They're present in our diet. They're over-the-counter products. They're really very safe and very, very well tolerated. But L-citrulline has the advantage of it's gradually converted in the bloodstream into arginine. So in effect, it works like a time-release version of arginine and helps your body to continue to make more nitric oxide and therefore more cyclic GMP. In people who are having mild effects or mild difficulty, I should say, with erectile function, supplementing L-citrulline actually can make a significant difference. You may actually see a Viagra-like effect without getting all the potential side effects and the costs and everything else that are associated with those types of medications. And frankly, it's a quite healthy thing to do in general. It's just good for vascular function. So it actually turns out to be one of the supplements that I generally recommend on a relatively routine basis for our patients. And so you want to take, if you're going to do this, about 500 to 1,000 milligrams of L-citrulline. It can be taken once a day, can be taken twice a day, and just be taken on a regular basis, and you'll generally find that it really does help. All right, so now we've helped to restore our cellular control of arterial function, but there's even more that we can do to help you improve blood flow into the penis and improve erectile function. And that is with one of the latest techniques, something called acoustic wave therapy. Now, acoustic wave therapy uses high intensity sound waves that can penetrate painlessly through the skin, but the instrument that is used to deliver this uses a very focused sound wave so that it concentrates at a specific depth within the vascular tissues. And once that sound wave gets there, the impact of that sound wave stimulates the growth of new blood vessels. It helps to break up any microscopic plaque that's present in the arteries there. And it actually ends up helping to restore better blood flow in those narrowed arteries. So this procedure will actually increase the presence of blood flow and achieve better erections. It's a fairly simple procedure. It's done in the office. It takes about 10 minutes for each treatment. Doesn't require any kind of anesthesia or anything to numb things up. You generally would do it about once a week for about 6 weeks. And you'll start seeing results after about 2 to 3 treatments. It has no side effects. It's really very, very well tolerated. So, excuse me. End result, it's a procedure that basically will give you stronger and more long-lasting erections. There's often a dramatic improvement in men who have erectile dysfunction, but even in those men who still have good function, it can turn the clock back by about 10 or 20 years. So the bottom line, sum up things here. The key to maintaining good performance, number one, keeping your arteries as clean as possible by finding and treating atherosclerosis as early as possible. Number two, keep your nerves healthy. Avoid becoming diabetic, avoid overusing alcohol, avoid other things that can cause nerve damage. Number three, avoid developing excessive visceral fat to help support nice, healthy testosterone levels, and supplement your testosterone if your levels are getting too low. And next, medications like Viagra and Cialis that can be helpful, but you may be able to get just as good a boost from improving nitric oxide production with taking L-citrulline on a daily basis. And then finally, acoustic wave therapy can help you really turn back the clock by boosting the blood flow directly where you need it. So now that we've gotten everything working the way we'd like it to be, then I think we can move our discussion on and talk about some of the things we can help you with to look and feel better and maybe take better advantage of how you've gotten erectile function and overall men's vitality working a little bit better.
Wonderful. Thank you so much, Dr. Fein. Really appreciate it. As a reminder for the folks that maybe joined us a little bit late, we will be doing a Q&A session at the end of the webinar. Feel free to add any anonymous questions down to the bottom throughout the presentation, and we will address your questions at the end. Now that we've discussed caring for your body from the inside, we're really ready to talk about your outer appearance, and I will hand this presentation over to Dr. Barry DiBernardo, who will speak on trends in facial aesthetics, as well as male body enhancements.
Okay, thank you, Rebecca, Dr. Fein, great presentation. And I was very excited about this combination webinar we're doing. I guess we're going to move from the plumbing department to the art and sculpture department, but everything that Dr. Fein says you have to take to heart, because not only the male performance, but in the past, I've had neighbors, friends, colleagues, all have problems, die even, because they had medical problems that they did not know about. And I frankly have too many people relying on me and at home, in my office, to be surprised by a problem that might pop up. So I've actually been to Princeton Longevity for many years now. I think I've gone 3 times to make sure there were no surprises. And it's actually a very gratifying thing to walk out of there with that report and know that you're either fine or catch something early so it doesn't become a problem later. But moving on, our discussion here is it's really a combination of what I'm going to do for you. If you do look good and you're not healthy, what good is it, and vice versa. So that's why I love this combination of what we're doing today. So I'm going to go ahead and get my slides up, and we are going to talk about male aesthetics. And let's go. So I'm going to run through a bunch of things that we do. We do lots and lots at New Jersey Plastic Surgery. We try to be one of the premier plastic surgery practices in New Jersey and the country, but we also have New Jersey Clinical Research Center, where we do lots of research on moving the aesthetic field forward with a lot of non-invasive procedures, and we do a lot of research too. So I'm going to run through skin, injectables, hair. Hair is important for men, face, eyes, neck, female breasts and male called gynecomastia, getting nice body contouring and enhancing our muscles. So going through skin, younger men can have acne scarring, or pigmentation problems, and it's easy with whether that's topical care, medical grade skin care. Some of the lights and laser devices we do can clear that up. One of the most important or common treatments that men come in for, that in literally minutes, 2 or 3 minutes, can really rejuvenate how you look, is are the lines you can have in your face coming from muscle movement and using Botox, the brand name, the newer one called Jeuveau, and probably in a few weeks will be one of the first practices have a product called Daxi, which is the longer acting Botox, may last up to twice as long. So those are very quick and easy just to refreshen the face with a few simple injections. A lot of men come in for excess hair. The look now is to have less hair all over the body. And years ago, we had lasers. We actually had the first laser in the country to do laser hair removal. But now we've gotten new technology that we can do a whole back like this in literally minutes. We can do arms, legs, chest, anywhere in the body with laser hair removal. In lighter skin or darker skin, we have lasers for every color skin. Um, Tattoos are very popular today, but sometimes people don't want those tattoos, or they tattooed the wrong person's name on their body and they need to get rid of it. So we have the Pico laser, which is one of the more advanced lasers to remove all different colors of tattoos. And this again is done in the office in minutes. And some people just want lots of tattoos and need to clear off more room to get new ones. So lots of reasons for people to get tattoo removal. Acne scarring can be devastating, and some it's bad enough to have acne, but if you don't treat it well when you're younger, it leaves scarring, and that lasts with you for years into your adulthood. So we have three different type treatments for mild, moderate, or severe acne that we can do with energy sources, with lasers, and it's so gratifying when a young man like this comes in and just was so shy because these scars were on his face, and to transform that, this is something called acne laser. We have a small fiber under the skin that we can like saw and remodel the skin from underneath and really clear that problem and change someone's life just by um, clearing what's on their face like that. Same with acne. You can have adult onset acne. We have topical programs. We have laser type devices that, rather than going for years with surface and pills, we can just blow it out of there. And this is our acne program. So one of the most popular categories for men is hair, because men are supposed to have hair. If you lose hair, it can affect confidence. But we're going to spend a little time on hair right now. And today we have several possibilities. If you've lost it, especially in front, and it's just gone, and we can't do anything about it, we have hair transplant. We do have supplements that you can take that are the building blocks that need to make more hairs, and lasers you can use at home to stimulate more hair, and then some topical treatments as well. So let's just get into the hair section a little bit. So some people's professions really require hair, or for them to look good. Kevin Costner here, you can see with hair, without hair. Very different look for him. And then, of course, some people look like they have more hair, and it's a very complex process, but it works in these four directions, and to get something like this. But we've worked in hair for over 30 years now. I've written chapters in the major textbooks in hair transplantation, and it's changed over the last 30 years. There used to be these large plugs, we called it doll's hair, just a very bad situation. Uh, Over the many past years, hair was removed from the back, called the strip method, which left a scar like this. And many today still use this method. In fact, I heard of someone today getting one in Cleveland, and they did that strip method. But that's not the state of the art today. We're in our third generation of device for hair transplantation. The one we use now is called Smart Graft, and it's a revolutionary device that uses it's called follicular unit grafting, where we take hairs as they grow naturally, single hairs, double hairs, triples. That's how they grow. And we remove them from the back of the scalp where the hairs are programmed to not fall out. And then we'll move those to the front of the head. And we can do thousands of those at a time. It's a single session done in the office under local anesthesia. And this can make a big difference in someone's hairline. Richard seen here, he's the owner of one of our big salons in town, and you can see he was thinning in here, and we added more hair naturally. And when you look closely, the quality of the hairline is most important. Today, uh, people rent techs to do these procedures, and many more people are doing hair today. But the artistic nature of it, to take single hairs in the front, followed by doubles, by triples, to look close up, and you really can't detect that any procedure was done. And just a few other before and afters to just show how good quality hair can come from fine hair transplantation. It looks very natural and really frames a person's face and changes usually their outlook and their approach. Some are very shy because of the hair loss, and by restoring a good hairline, we can build good confidence in men. And again, here on the left, I show you the thinning and then the hair grafts that you really can't see any scarring. You really can't see that they're hair grafts, and you can see that up real close like this. Some men come in and have a combination. They need some in the front, some in the back, and it's our job to really calculate where's the best use of these grafts, because we don't want to use them all up and maybe make it a little stronger in the front, a little thinner in the back where less people see it. And we will also get men who have had hair transplants years ago and they just have old techniques, terrible looking grafts, and we can do restorations where we can really rejuvenate that and change their appearance from that. Other than hair transplant, some of the big advances have been in the non-surgicals today, particularly the supplements and the laser caps. Lasers are used for many different purposes, and we can also use them to regrow hair. The one I'm going to talk about was studied at the Wellman Lab, which is a laser lab at Harvard. It's the best in the world. And for those who took biology, the mitochondria in your cells have chemical reactions going on in the little walls. And I don't, I'm going to quiz you at the end to see what this all means. But basically what this is doing is forming ATP, energy for the hair cells, and the red light is really increasing that reaction. And as the reaction increases, you need to take certain building blocks. Just as Dr. Fein said, there's certain supplements for further down in the body. There are other ones that the hair require. And this is someone who's already had a hair transplant but wanted to thicken it up with the laser. These are only laser results 2 months later. You use this cap at home 25 minutes every other day and take the hair supplements for the building blocks, and you can see great results. It can actually, the studies at Harvard showed it can actually stop hair falling out by up to 90%. So these are very powerful tools, and these are some of the supplements. One's called Healthy Cell, one's called Nutrafol, that can actually work with the laser. And that laser, by the way, is not the ones you see in the magazines, on the airline magazines, on TV. It's the real deal. It's a medical instrument and has a lifetime warranty. We're going to move on to the skin, and everything as age progresses, things get more loose, things tend to drop, and what can we do to help that? So one of the main subjects of our research in our facility is how can we use energy and non-surgical methods to tighten skin, and we use lots of those. We've done many studies in the neck. When we look at faces, whether it's a male face or female face, we break it up into thirds and look at what makes that person better looking, and or where are the deficiencies. One of the big problems that can happen as you get older is the muscles in the neck. You can get loose skin, you can build fat, but you can get those turkey neck muscles, they call them. And we have new techniques now that are minimally invasive called MyElevate that can eliminate those muscles, reduce fat, tighten skin, and even this is a MyElevate in someone who's older, but it can really help the jawline. These procedures are done sometimes in a matter of an hour in the office under local anesthesia, and really can transform the neck, which is something that is really people look at your neck, they look at your eyes, and this is a 74-year-old person, so we can do it in many different age groups. And again, the big advance, whether it's a MyElevate or a MyElevate Plus for older people, is that men especially don't have a lot of downtime, can't take off from work, don't want people to see things. So these have a very quick recovery as well, far different from what we've done with major facelifts and neck lifts in the past. Getting into body contouring, um, we can do anything in the body from the chest, the abdomen. These are legs. This guy wanted thicker calf muscles. Implants are probably not the best idea. They have a lot of problems, but this is using his own fat to build the calf muscles with what we call as fat grafting. I said male breast reduction is something quite common in men, usually in teenagers. The hormones are all off. They produce more estrogens that Dr. Fein was talking about, but then it can normalize and go away. But many still retain that fat and the larger breast. So this is called gynecomastia, and we can do treatments to reduce that, to reduce the chest area. We can also work on the abdomen and reduce fat there. So many have a weight problem and have massive weight loss going to not us, but bariatric surgeons or going to Dr. Fine to go on programs to lose the weight. But a lot of times the problem is it's not that you've lost the weight and gotten to your goal. It's now I have all this loose skin and I still don't look good. I still can't put that bathing suit on and go to the beach. So we have a lot of different treatments we can do to tighten abdomens. This guy has excess in his medial thigh, so we did a medial thigh lift, and we can do surgery for those things. And in these papers we published in the medical journals, we can use lasers to tighten this and also take it to the far end and use lasers to do, it's called 4D body sculpting. This is actually an illusion of sculpting the fat to make it look like you're very muscular. And we need to look at the anatomy first and create that look. So you can do it by us sculpting you, or you can do it by exercising, and we have other treatments. These are all 4D body sculpting. You have fat there, and we can work with it to really change how your body looks tremendously, if you will, if we do front and back. So these are all versions of high-end liposuction that we do the way our colleague in Bogota, Colombia, Dr. Hoyos does. He's come up here and we've done courses with him. And then you've heard this word throughout this presentation, M-Sculpt and M-Sculpt Neo. Um, we do now have non-invasive devices that can melt your fat and can build your abdominal muscles, your oblique muscles in the office, and do it non-invasively. It's basically a 25, 30-minute treatment. You do it once a week for 4 times. This is an M-Sculpt. This is what the machine looks like. And what it does is it uses a combination of um, magnetic muscle contraction. So if it's your abdominal muscles, it's like doing 20,000 sit-ups in half an hour. Uh, there are new applicators we have the first ones in the country for the oblique muscles for the waist, which are much more powerful. And those are called the edge applicators. Here's one of our patients who's lost some fat and built up some muscle. So for those who are waiting to see what the prize is, the prize of the raffle is 4 M-Sculpt treatments at our office, and whoever wins, please contact us. We'll be happy to treat you. And it's called HiFem technology. And I'll just end with a couple memorable treatments, patients we've treated over the years that just have had fabulous results. This young man contacted me when he was 16 years old. He was 850 pounds. He couldn't get out of bed, and he lost the weight on his own with no surgery. And that was many years ago. We did it when we did it on ABC News. And play the tape forward. He's now a motivational speaker. It changed his life. This is what he looked like before on the left, and example of just so much extra skin on the arms, on the breast, on the abdomen, on the legs. And we worked on that to really sculpt him to get to a functional body that again changed his life completely. And now he's speaking for others to get them motivated as well, as he did it. That was Justin. And this is the last person I'll show you. This gentleman, he came in to me, and we get all sorts of requests. And this request was, um, I'm writing a book. It's a book on business, and I'm feeling old. I'm looking old. He should have gone to see Dr. Fein, but he said, I want to transform myself so when they take the picture of me in the back of the book, I want to look good. So we did injections. We did his skin. We did his hair. We worked on his neck and all these things, and just worked and worked for many, many months. And here's an interim phase when he now had more hair, skin was getting better, the lines were starting to tighten things. And then he had his photo shoot and ended up like that. So again, huge transformation. So the conclusion is what we do at New Jersey Plastic Surgery is the traditional techniques. We have three top plastic surgeons, Dr. Tur, Dr. Travato, and myself, and our other providers. And we try to use the latest techniques for all aspects of aesthetics. And if it doesn't exist, our research center is working on it to try to get us there to the future. So I thank you for listening. And here's our website, our phone numbers, and please feel free to come in so we can give you an opinion and help you. But the ultimate combo is, look, if we can make you look good, you need to be around to enjoy it and to function that way. So use both the services of ours and the ones of Princeton Longevity Center. Thank you very much.
Oh, thank you so much, Dr. DiBernardo. Really appreciate it. I believe we all learned a lot tonight about both inner and outer men's health, vitality, and aesthetics. I'm really excited to get to some of these questions, and I'm going to go ahead and present here. There we go. So that way you can scan if you need to get to any more information. But we had a few really great questions that came in. And the first one is for you, Dr. DiBernardo. Regarding trends in male aesthetic procedures, are you seeing more men coming in to have these procedures? And what procedures are you performing the most?
It's really changed in the last couple of years. Plastic surgery and what we did was always predominantly women. But in the last few years, the men have been making a larger and larger percentage of who we see because they want to look good too. And we have techniques today that make it easier for them. I think some of the more popular things are the injections like fillers and the toxins. A lot of them are getting their lower face with the Elevate procedure done because it's a quick recovery and they can look good on the Zoom calls. And hair is always popular too, but and then just body contouring. Men want to look good on the beach too, so really they take advantage of many of the things we do. But the trend is just increasing, and the men are giving the women a run for their money now.
Excellent. Dr. Fein, question for you. What do you think about over-the-counter products that are advertised to boost testosterone levels?
That's a good question. And there's a lot of different ways to look at that. And first off, you have to start off with, do you really even need that? Very often what I think a lot of people might be perceiving as they're getting low testosterone because that's what they're hearing on a lot of TV and radio ads, is actually probably more likely related to they're seeing changes in vascular function, and maybe it's more about that nitric oxide pathway and trying something like some citrulline that might actually help to improve function. The problem is that most of the over-the-counter products, they tend to have things, the ingredients in them that they're not really particularly effective at raising testosterone. In fact, most of them have really little or no proven value at actually significantly raising testosterone levels. It's a little bit hard to actually get testosterone levels to come up. Even when we're using testosterone supplements transdermally and actually giving people actual testosterone, we often find that it's hard to get them back up into the normal range, and you often have to do it by injection. So I'm not optimistic that most of these testosterone boosters you see advertised on TV are going to do much. In fact, actually, if you look at the labels on some of them, the most active ingredient they have in them actually is the citrulline. Small doses in there, but enough that it actually produces a little bit of an effect.
Excellent. Thank you. We're getting several questions here about the acoustic wave therapy that you spoke about. Is acoustic wave therapy helpful in men who have prostate problems? And is it safe for those who have enlarged prostates?
Well, I mean, in terms of the issue of safety, let's talk about that first. First of all, what we're dealing with here are sound waves that are focused to concentrate at a very specific depth just below the skin. So even if you were to inadvertently direct it in the area where it might be pointed towards the prostate, it's not going to go that deep. There's not going to really be any potential for any effects on the prostate, whether you have an enlarged prostate, whether you have had prior prostate biopsies or surgery or anything of that sort. Should not be a concern. It's one caveat to keep in mind. That's the one area, though, where the acoustic wave therapy is probably not worth trying, is if you have unfortunately had prostate cancer and have had prostate surgery or some other medical treatment or surgical treatment that has ended up with you having erectile dysfunction. It doesn't tend to work as well for that, because the problem there isn't really vascular. It's more about impairment of nerve function that has happened from injury around the prostate. But outside of that, there's really, if you just simply have an enlarged prostate, because this is working on the vascular structures within the penis itself, it should work perfectly well. You should see just as good an outcome.
Excellent. Thank you. Going back to you, Dr. DiBernardo, a little bit specific, but if someone has limited downtime, but they want a better looking neck, what are their options?
Well, we have to define what limited is. We basically have three categories that we've defined in our society now: surgical procedures, minimally invasive, and non-invasive. So procedures that are non-invasive have no downtime, and you can do what you're doing in the next 10 minutes. Minimally invasive can have just a few days of recovery, and surgeries can be more. So we really need to know what they mean by that. But if we, for the neck, the new gold standard is the MyElevate procedure, which I would look that up, because it can get you tremendous results with probably less than a week of downtime, and there are no incisions and there are no sutures, so that gets you the biggest bang. For that, we do have other treatments that are non-invasive but won't get you as much result, and that's usually the answer for everything. The more invasive it is, it could be bigger results. However, with the MyElevate, you can get face and neck lift results in a fraction of the time of the recovery without the incisions.
Excellent. Also getting some questions here about the male breast reduction and recovery time. Can you speak a little bit to that, Dr. DiBernardo?
Yes. So when we examine the breast, the male breast, usually there's a combination of fatty tissue there, mostly fatty tissue, but under the nipple and areolar area, there can be more firm breast tissue. It can be minimal, it can be an acorn, it could be much bigger. oftentimes we just make a tiny little incision, less than a quarter inch, and come in from the side. We use vaser sound waves to break up the fat and then remove that fat, and that can help. If there is any other tissue, we can just make a small incision around the areolar, the nipple area, and get that firm tissue out. And then after that, again, probably just like one stitch on each side, wear a compression vest for a few weeks, and after 3 weeks, 4 at the most, you can go back to full exercise, gym, sports, whatever you want to do without that chest.
Wonderful. Dr. Fein, I have a few questions coming in for you as well.
Sure.
Do you recommend ginseng and B vitamin supplements for erectile dysfunction?
You know, the issue there is, they may be helpful, they might not, but there isn't really great data that says that you're going to get a tremendous effect from those in terms of erectile function. I think what you're going to get from trying something like arginine or citrulline or doing any of the prescription medications, or certainly what you're going to get from doing the acoustic wave therapy, it's going to be a couple of orders of magnitude more effective and much greater effect. So yeah, I don't think that ginseng is likely to be harmful. I just don't think it's likely to be dramatically helpful.
Excellent.
Same with the B vitamins. I mean, it's pretty hard to be B vitamin deficient in this country. You can pretty much, you know, live on junk food and it's still spiked with so many vitamins that you, I don't think you're going to get much bang from adding more.
Excellent. Going back to sound waves, a viewer is asking that it used to require numbing cream. Is that still the case for that procedure?
Numbing cream for the acoustic wave
Correct.
procedure? Generally not. We don't. We use a what's called ultrasound gel, which is just a gel-like substance that helps to improve the transmission of the sound wave from the device into the skin and through. And if you're doing it properly, if the operator who is administering the treatments knows what the limits of tolerance are, so that you don't do too many of these sound waves in one spot. The overall effect of it, if you do this, is it feels a little bit like if somebody was flicking your skin with a fingernail. That's pretty much about the sensation that you get from doing this. As long as you don't try to administer, you know, 1,000 pulses or 2,000 or 3,000 pulses in the same spot, there's actually no discomfort. There's no pain. So the key is simply just to move to a couple of different locations as you're doing each treatment. And I mean, afterwards, there might be a little bit of minor tingling that lasts for a few minutes or more. But other than that, and it's really a well-tolerated procedure, so we don't really need to numb anything up.
Excellent. This is another good question coming right off of that. Can I do acoustic wave therapy at home with medical grade machine that I buy out of my own?
It depends what we mean by medical grade. I mean, there is a product that is sold. You can find it online called Phoenix. It is a relatively new device. You know, I haven't had direct experience with it myself, but I can tell you that having looked at the product and looking at how it works, the issue is that the device that we're using in our office, it uses a very focused sound wave that is it's produced by a parabolic mirror in this thing that really directs the energy into a very specific point. From what I can tell of the home use ones, I'm not sure you're getting quite the same level of directed energy where you want it. I'm not sure that you're getting quite the same strength out of it. It's just very, very hard to say whether or not it works. The one thing I have noticed is that whereas the equipment that we're using, you'll typically see a result within 2 to 3 treatments, and typically 6 to 10 treatments is enough to keep you in really good shape for a couple of years. The Phoenix basically says you may start to see results within 90 days, and it's sort of an expectation that you'll continue to use it on an ongoing basis, at least once or twice a week. So I think that tends to argue that it's just not nearly the same level of effectiveness and strength as you're getting from the more robust equipment that's used in doctors' offices.
If I may, we see a lot of that with all the devices we work on, and the FDA has regulations, and there's just so much energy, whether it's ultrasound, radio frequency, whatever the waveform light that you can use at home. They're not going to let you do anything that's unsafe, but as Dr. Fein said, it's often very underpowered, and if you do it all year, maybe you'll get some sort of result, but nothing that comes close to what we're allowed to use in the offices.
Exactly.
Absolutely. Dr. DiBernardo, I'm going to go back to you here. We're getting some question about under eye treatment. What's the best treatment for under eye puffiness and dark circles, in your opinion?
Two different problems. When we look under the eyes, you can have loose skin, you can have dark skin, and then the puffiness is usually from little pockets of fat under there. Again, there's a full gamut. We have devices. If things are minor, we can rub energy on the surface. For the dark circles, from the mild laxities, we have very good lasers, single treatments we can do in the office that take about 15 minutes or 30 minutes and can tighten that and lighten the coloration. Often if it's big puffiness there, that's the deeper fat, and we do have to do a surgical procedure called a lower blepharoplasty, and that's how you get inside to get that fat out. But regardless of what those problems are, we have solutions for all of them.
Excellent. And this came in from somebody that's in their late 50s, and they have a receding hairline in front at the temples. They know that's normal, but they'd like to combat it. What would you recommend?
At that age, so when you're at that age, when you're in the 20s, things are all going to change. They're not going to be stable. We have no clue where it's going to go. As you get in your 40s, 50s, early 60s, your pattern is now stabilized. So if there's loss in front, the likelihood of us bringing back hair with some of the non-surgical things is not likely. So that would probably be a hair transplant. This person would be a hair transplant candidate, and we have to look and do a design in the front and the sides, and also evaluate what the density is in back. How many hairs do you have that we can use to do this? And that is why you want to go to the experienced hair surgeons, because it's not the rote. Anyone could take hair and put it in front, but it's knowing how many you have for the future, and the design of it, and how to take the ones you have and use them most efficiently. So the person that we're describing probably would be good for an evaluation for a transplant.
Excellent. Another question for you here. Is M-Sculpt different than CoolSculpt? CoolSculpt, and how?
Yes, night and day. So the original non-invasive fat device, we had, again, one of the first ones in 2009, the CoolSculpt. That is freezing the fat, and it will remove, in a treatment, 22.4% of the fat, so about a fifth of it. And you'll see that result after about 3 months. CoolSculpt machines can do different parts of the body. They do fat only. By definition, M-Sculpt was the next machine that came out that does muscle building in all different muscles in the body, but not fat. But the newest machine, the one we use now, called M-Sculpt Neo, with magnetic waves for the muscle, radio frequency for the fat, it does both removal of fat and toning of the muscle. So the reason in our office we lean more toward the M-Sculpt Neo, it probably feels better, but also if you're reducing fat and toning at the same time, that's the perfect combination. And so it is a little more advanced at what it can do than CoolSculpt alone, which is just fat.
Excellent. Thank you very much. Lots of comparison questions. This one is for you, Dr. Fein.
He gets a
how
turn.
is the shockwave therapy that was shown different than Gainswave therapy? And can you comment on scrotox?
Comment on what? I'm sorry.
Scrotox? Scrototox?
On, well, as far as the gains wave, it's basically the same thing. Gains wave is acoustic wave therapy. It simply is a kind of trademark brand name of that was a protocol that was created by one specific physician, and he's just been marketing it under that name and essentially franchises the protocol out to other physicians. But there's really not any difference on a physical basis between what we're doing with that. I can't say I'm familiar with the other.
Want me to do that one?
Yeah, you can handle that one, Barry.
I don't do that. I'll handle the question. So Scrotox is using Botox in the scrotum, and I believe the idea there is by relaxing muscles, you get things hanging more. But having said, so people do that. We don't do that. I I think whoever you're going to go to have it done, make sure they really know what they're doing, because I've reviewed cases where there have been very bad situations of not only the toxins injected in the wrong area down there, and Dr. Fein showed all the muscles and the nerves, and you want to make sure you're in the right spot, but really use caution when some are injecting fillers down in that area to make things bigger. Again, I've had to review legal cases where people actually lost parts down there from misinjections. So use caution and make sure if you are going to go to someone that's very, very experienced in this.
Excellent. Thank you. Dr. Fein, can you also speak to what a normal testosterone level would be?
It's actually a pretty wide range. That's part of the problem. There's also another factor that you have to consider. I see people come in all the time who've been told that they have a normal or a low testosterone, and the normal range in most labs tends to run somewhere in the ballpark of 700 or 800 up as high as 1,500 or even 1,800. So, I mean, you're talking about, more than a factor of 2 or even 3 and still being within the normal range. But that's not even the issue. Testosterone circulates in the blood in 2 forms. Almost all, about 99% of testosterone circulates bound to a carrier protein called sex hormone binding globulin. And that portion of the testosterone that is bound to the carrier protein is physiologically inactive. The only thing that really matters is the unbound, or what's called the free testosterone. That's that small percentage of your testosterone that isn't at any given time attached to that carrier protein. So if you're going to measure testosterone levels and try to determine if somebody truly is testosterone deficient or not, you actually have to be measuring both total and free testosterone. And the normal range for free testosterone is typically somewhere in about the 7 to 15 range, thereabouts.
Excellent. Thank you. Another question for you. What do you think about PRP injections for the penis as a method for reversing ED?
The short answer, it hurts like hell. That's the biggest problem with it. I mean, sometimes some people refer to it as a P shot too. You'll see it on websites talk about it in that regard. We don't do it primarily because we haven't had the need, and I think it's just too darned uncomfortable. I have had other people who have said they've seen very good effectiveness with it, and you can combine it with the acoustic wave therapy, but it just seems a little bit drastic for us. And so if you're willing to go through the discomfort, you may see some response. Basically, what you're doing is you're taking platelets from the patient's own blood and then concentrating them and re-injecting them back into those tissues. And this is done for a lot of things other than just erectile dysfunction. You can use PRP also for various orthopedic injuries like tendinitis and things of that sort. And doing that injection, it effectively almost acts like a stem cell in there and helps to regenerate new tissue. So you'll heal up a torn tendon that way. you may actually end up generating some new vascular tissue in the penis by doing that, but not for me.
I'll take a stab at that one also.
My choice
Maybe
of
not that
words.
word. Wrong word. Uh,
Mhm.
so PRP, you've got all these good things floating around in your blood, and if you spin it down and concentrate it, you can use them in certain areas, in a lot of areas of the body. And with what we do, we can inject it in the scalp to promote hair growth. We can use
Mhm.
it on the skin for improving the skin using your own materials that are in your body. So PRP is widely used today, I think, in a number of specialties, and it can have very good results. Sometimes it doesn't always do as much as people want it to do, but it has a
Mhm.
role, and it's up to the clinician to decide how it fits into the whole picture of treatment of that particular area.
Excellent. Thank you. Another question for you, Dr. DiBernardo. Are you performing penile elongation surgery, or do you have an opinion there?
We don't do it. It's just an area we probably do 80 to 100 different surgeries. We don't do that one. Um, I would, and there's a whole gamut of what those surgeries are, and you have to, it's a longer discussion than a quick answer. Like there's a small surgery where there's a ligament up there, and if you release it, things kind of fall and get longer. That's
Mhm.
really easy to do. Um, Probably want your urologist to be working down there more than us. Um, then there are the fat graftings that we're talking about. You can elongate or you can add girth, and with that, you can. I already spoke about people injecting things into there. You can put fat around those areas, but again, those are very specialized things. Not all plastic surgeons do that, and you have to find the ones who do it a lot and are experienced at it. And it may not be a plastic surgeon; it may be a urologist for certain of those procedures.
Excellent. Thank you. I have a few more questions for you, Dr. DiBernardo.
All right, I'm ready.
Yeah, can my Elevate
Well,
also work for wrinkles around the mouth, or what is the best procedure for this?
So the My Elevate series is really a neck and jawline procedure. So it kind of stops here. Anything around the mouth, uh, we have a lot of different choices. If there are just fine wrinkles around, we have a new filler product called Redensity, which is it's a newest filler for filling in etched in lines that does wonderfully, and it's very quick to do. We could, if you have depressions, and these are called nasolabial folds, labiomental folds, if you have loss of volume there because our bones get smaller as we age, we can put your own fat in those areas. And the other choices, if you have wrinkling there or anywhere in your face, we have beautiful lasers that can kind of tighten and erase those lines on a long-term basis with a single treatment. So again, we have a number of different treatments. They all work pretty well, and that's why our consultations are so important, because you think one thing, but I probably have 5 different things we can use for the same thing, and we have to choose. We have everything, so we have to choose which is the best one for you and your problem.
Excellent. Going back to cool sculpting,
Oh,
if
popular.
you're, yeah, very, if you're overweight, obese, do you generally need to lose most of the weight first before you're a candidate?
Okay, so if if you are cool sculpting is not built for that type person. It's not for someone who's overweight. Cool sculpting or any of the non-invasive fat devices are for those who are close to their body weight but just have stubborn areas to get toned, like the waist, like a little bit of the lower abdomen. It's not really a weight loss device.
Mhm.
Um, so I would say if you're in a program, or go to the weight loss program and get there or get close to there, and then you're going to have your body close to where you want to be, but it's stubborn, it won't go any further. And that's when we can either use devices like that or do a liposuction or tighten the skin and take up the rest that you just can't make it on the last mile. But
Excellent.
cool sculpting is not a fat reduction device. These are contouring to make your body look good in stubborn areas.
Wonderful. Thank you so much. I think we have time for one more question here, and it's going back to Dr. Fein. When should TRT, HRT be seriously considered if free T levels are within lab range, but symptoms are still prevalent?
An interesting question, but I think that, I mean, you could give some consideration to the idea that if you're looking at free T levels and the normal range is 7 to 15 and somebody's 7 or 7.5 or 8, perhaps their body does better more up in the middle part or the higher part of the range at 10 or 11 or 12. I'd be very, very leery about the idea of trying to move somebody's testosterone levels above normal. You just get too many potential bad side effects that can happen from that. So the other thing you have to keep in mind then is, depending on what those symptoms are, I think you need to make a pretty diligent search for what else might be going on, that even though those are symptoms that are consistent with low testosterone levels, is there something else that's actually the underlying cause, and that it's not a low testosterone in the absence of having been able to document testosterone deficiency. So that's something I would approach probably with a little bit of caution and be careful about.
Wonderful. Well, thank you everybody so much for joining us this evening. Really such a pleasure. So much wonderful insight and information from both of you doctors. Thank you so much for being here. As a reminder, this will be available on demand. So if you wanted to go back and revisit a question or revisit a slide, that will be available to you. Also, any questions that we were not able to get to, we will be answering them for you. Those will be up in a blog. We'll send them out via email. So please be on the lookout for that. Also, that lucky winner, we are private messaging you now. Congratulations. And thank you once again for being here with us today. Really appreciate it. Have a wonderful evening all.
Okay, thank you, Rebecca, for hosting so nicely.
Thank you, Rebecca, and thank you to all our participants today too for your time and attention. Appreciate it.
Okay, have a good night. Thank you.
Thank you very much.
Take care.
Take care.